Hello friends, I am Dr. Patik Parikh and we are going to discuss today about an important aspect of liver disease. So liver disease is a catabolic state. The liver fails to store glucose as glycogen and also fails to produce glucose during the period of fasting. So in order to survive, the body breaks down the muscle to obtain energy. As a result, patient with liver disease starts losing their muscle mass and they even lose their muscle strength. And this is a sign of poor outcome. So one of the important aspect about managing the liver disease patient is to prevent this from happening. So good nutritional counseling and good exercise play an important role to achieve this goal. Today, we are going to discuss 6 crucial points of diet in patients of liver disease or cirrhosis of liver. So, point number one. So, period of starvation should be kept as minimum. As we said, that the more you starve, the more the muscle is lost. So the patients of cirrhosis should consume 3 to 5 meals a day and they should even have a late evening snack, and that is to prevent the period of fasting when they sleep. So we recommend patients should have a midnight something to eat so that when they go to sleep they have constant input of glucose from their intestine. Also, cirrhosis is a state of increased catabolism and they need extra expenditure, so extra energy. So whenever they face some complication, the need for energy further increases, and most of the patients of cirrhosis are malnourished. So they should actually be taking more amounts of energy unless they are suffering from fatty liver. Point number three, most of the time the Indian diet are containing less amount of proteins. So in patients of cirrhosis, they actually need 1 to 1.5 gram per kg of proteins. So if you are 60 kgs of weight, they actually need 60 to 90 grams of protein per day, and which is never going to be attained by the routine diet. So they should have some form of protein supplementation. This supplementation can be in form of lean protein like fish, eggs or chicken, and they can also have protein powders which are now medically available for supplementing the protein intake. However, they need to avoid red meat if their fatty liver is the etiology for liver cirrhosis. Point number 4. Oral diet in patient of this cirrhosis should contain at least 30 to 35 kilocalorie per energy. So they should divide their nutritional intake in such a way that they constantly have every 2 to 4 hours something to eat which is going to provide them enough calories. Point number 5. Now liver, which is a storage organ, fails to store micronutrients, and that's why all patients of cirrhosis should be supplemented with some amount of micronutrient supplementation like zinc, calcium, vitamin D, vitamin B12, folic acid, as well as trace elements. Point number 6. They need to reduce the salt intake, but they do not need to stop it completely. If they take around 4 grams of salt per day, that is enough. So how do you calculate? Either we make the food without salt and add 4 gram after making this food, or what we recommend is actually asking the patient to just take routine salts in dal and the vegetables or the sabzi, and avoid taking extra added salt in form of added salts onto the food items. Besides, fluid restriction is not recommended for all patients, but it is recommended for patients who are having fluid accumulation in their body in form of ascites or pedal edema. They are not to just reduce the fluid intake in form of water, but overall fluid intake has to be reduced, which needs to go down to around 1.5 to 2 liters as per your hepatologist advice. So these are the important 6 points about diet management in patients of cirrhosis. I hope you find this useful. If you need more clarification, you can either contact your nutritionist or your liver specialist. They will take it further. Thank you.